So how do these initiatives happen, and how do we prepare for the ones that are on our radar? The secret sauce to Henrico's success starts with the efforts of our Economic Development Authority, our business community partners, and our community development agencies to support a diversified economic base. That economic diversity is key to a tax base that is not a tax burden, having the right mix of residential and commercial development that keeps our services well funded while maintaining a low tax rate for our residential and commercial community alike. For over 35 years, Henrico has had the lowest residential tax burden of the 10 largest localities in the state, while maintaining exemplary levels of service in our infrastructure, facilities, and services to our citizens. Even with this low tax burden, we recognize that there are some Henrico residents who struggle just to get by. So the county is proud to be in the position to provide tax relief to some of our most vulnerable residents. Henrico's Real Estate Advantage Program, or REAP, and our new Real Estate CAP, or RECAP, offer some of the most generous eligibility thresholds in the Commonwealth to those who are over the age of 65 or permanently and totally disabled. While the REAP program celebrated its 50th anniversary this year, the first year of RECAP provided protection for elderly homeowners from the impacts of rising home prices. REAP and RECAP have had a tremendous impact on the most vulnerable of our community. Those who benefit the most are the 2,100 property owners with a taxable annual income under $20,000. This program keeps residents in their homes. Our economic stability and strong financial management enable Henrico to offer tax relief to businesses as well as residents. In calendar 2025, we will be exempting the first $1 million of gross receipts from our business license taxes. It's okay to clap for financial stuff, though. Despite the impacts of exempting $18 million in real estate and B-poll taxes, the county continues to add stability to our financial picture through additions to our general fund balance. Stable and growing reserves provide flexibility for the county to respond to changing economic conditions or unexpected needs for services. That financial stability is complemented by a commitment to high financial standards. While a AAA bond rating puts the county among the best of the best nationwide, Henrico exceeds even these highest standards with conservative, self-imposed financial ratios. In short, Henrico County holds itself to a higher standard. Our conservative approach to financial management spills over into the budget process. Each year, our budget team forecasts anticipated local revenue that supports our operations for the upcoming fiscal year. By keeping these revenue estimates low, we build a solid operating plan for the upcoming fiscal year that can withstand unexpected impacts or provide resources for unanticipated needs. At the end of each year, our annual revenues exceed our budget, providing financial flexibility to provide for our community. It's now my pleasure to turn it over to Ms. Gretchen Brown, our Director of Social Services, to show you more about how the county uses resources to meet the needs of our community.
I have the privilege of sharing how our employees, in partnership with our community, are working beyond our mandates and expectations to provide next-level human services to support a safer and healthier community. Empower Henrico, formerly the Addiction Task Force, has set a gold standard for how we treat, support, and prevent substance use disorder in our community. These efforts have contributed to a 39% decrease in overdoses and a 31% decrease in drug-related fatalities in the county. Empower Henrico has been a catalyst for change, instrumental in accessing funding from the Virginia Opioid Abatement Authority to create groundbreaking programs that actually work. We have a new mobile unit that's going into communities to offer treatment and other life-saving services to our residents. In a partnership between the Richmond and Henrico Health Districts and Henrico Area Mental Health, a clinician, prescriber, peer, and nurse work side by side to break down barriers and provide access to critical health and mental health services, including treatment and the distribution of over 350 doses of naloxone, medication lockboxes, safe medication disposal kits, gun locks, prescription savings cards, and other harm reduction supplies. In partnership with Charles City and New Kent counties, Henrico Mental Health is providing intensive services for women who are pregnant or parenting and who have a substance use disorder. Since this program started last December, 23 moms have been connected to treatment, therapy, psychiatric services, housing referrals, peer recovery support, community resources, and childcare. When needed, services are also provided to their children. Through this program, 22 children are now living with their mothers, 15 families are working towards reunification, and 4 healthy babies have been born. In July, the Department of Emergency Communications implemented the Marcus Alert system to enhance the local response to mental health emergencies. 911 calls are now assigned to an array of responses, including the county's mobile response team. This team includes a mental health clinician and a specially trained police officer who respond in a trauma-informed way. In its first 3 months, this is just 3 months of data, the mobile response team made contact with over 150 people experiencing mental health crisis. It's notable that these contacts resulted in only 1 arrest, with no use of force, and a small number of people requiring hospitalization, while we better meet the needs of our community through a coordinated continuum of care. We expanded our Connect program to a 5th community this summer. 24 youth living at St. Luke Apartments now have access to social, education, and enrichment activities. A special thanks to Senator Lamont Bagby, who gave us a giant check for $1.2 million and the expansion of this program year-round. Connect Plus provides a safe environment where 36 youth are receiving help with homework and tutoring, a hot meal, and access to programs for the prevention of substance use and youth violence. In addition, 2 full-time mental health case managers provide on-site services that are available to all youth and families living in that community. And we're just getting started. As good stewards of the Opioid Abatement Authority funding, we're focused on how we can best meet the needs of our residents. And here's what's on the horizon. Henrico Social Services received funding to hire a kinship navigator to better support youth living with grandparents, aunts and uncles, and other relatives, both in foster care and outside of the child welfare system. When children can't safely live with their parents, we know that relatives provide them with better outcomes in life, including a lower likelihood of developing a substance use disorder. We are focused on legislation and regulations for the substantial number of recovery residences in our neighborhoods throughout Henrico County, with the hope of setting and enforcing operating standards to ensure that these services are effective and that they are provided in a safe, meaningful, and ethical way. Construction on a detox center is expected in the very near future, and we are in active discussions about a crisis receiving center. And finally, Empower Henrico has started the Actively Aging campaign addressing substance use among our older residents. We're open to any and all suggestions for how to work more creatively to support our community.